chapter 21, factors influencing health status and contact with health services. Okay, and we're talking about Z codes from Z00 to Z99. Okay, no, the chapter specific guidelines provide additional information about the use of Z codes for specified encounters. So what are these Z codes, guys? Z codes are for use in any healthcare setting. Z codes may be used as either a first listed or principal diagnosis code in the inpatient setting or a secondary code depending on the circumstances of the encounter. Certain Z codes may only be used as first listed or principal diagnosis. And also, Z codes are not procedure codes. A corresponding procedure code must accompany a Z code to describe any procedure performed. Let me give you a little background on what Z codes are, guys, okay? Z codes are used in many instances, okay? These are not, most of them are not diagnosis codes. Yeah, they're not diagnosis codes. There are most of these Z codes are informational. Okay, so when I say informational, these Z codes are for the use for the Z codes, which we will cover in a little bit, guys, are for like counseling. If patient needs to go visit the doctor, what kind of screening that a patient has scheduled for. If a patient had a previous procedure, history of that procedure, and the patient has a certain limitations as to the movement, or if a patient has a device in his body, in her body, that needs to be reminded the next user of a chart that you have to be careful with this patient because patient has this. So those are these type of circumstances, guys, that need a Z code. So Z codes are informational for the most part. Okay, so if a patient is a carrier of some kind of a virus, if a patient is say needed to go have some kind of prophylactic procedure, like if a patient needs to have an immunization or a vaccine or a shot, that's a Z code. So they're not diagnoses, but these are codes that are assigned to the patient, to the chart, for information purpose. Okay, so that's how I view Z codes are. Another example that I can give you guys, we have already covered many of the chapters which have Z codes used for information, right? So example will be in pregnancy. If you wanna declare that a patient had a successful delivery, a single live-born baby was delivered by this mom, right? So you assign a Z code to pretty much declare that this is a live-born delivery. That's a Z code. Now, if a patient has a condition that is called morbid obesity, and you want that information about the patient's BMI be put out there, you need a Z code, right? So these are the different uses of Z codes, guys. Okay, if a patient is another example is if a patient has advanced renal disease, advanced kidney disease, which will require a dialysis. So you put a Z code, you attach or assign a Z code to let everybody know that the patient is currently on the dialysis treatment. So you get guys what I mean about Z codes for specific purposes, right? They are informational for the most part. Yes, if a patient is insulin dependent, you are to assign that code. It's not a diagnosis again, it's an information telling everybody, hey, this patient is insulin dependent. Okay? If a patient has a pacemaker, right? Status pacemaker, patient cannot be subjected to a procedure that is magnetic in nature, like an MRI. You cannot have the patient undergo this type of procedure. So you attach a Z code to the patient's medical record to inform everyone that patient has a pacemaker and cannot be subjected to that type of procedure. So Z codes, guys, have many different purposes of basically, or for the most part, are informational. Sometimes I call Z codes as for your information or FYI codes. Okay. Yes, BMI is an information. If a patient was admitted with a really high blood alcohol level, right? And I don't know if blood alcohol level is a Z code, but what I'm trying to say here is that these Z codes, guys, are not diagnosis codes, are not conditions. They may be health status to declare that a patient has this particular situation or health status, like if a patient is an amputee, there is a Z code for that. Okay, if a patient had, say, had undergone a transplant procedure like a year ago or just lately, right? That's a Z code. You are to assign Z code for that. If a patient is on catheter, that's a Z code. More of like a status. Yes, Brittany. Status. Matter of fact, status is one of those classifications for Z codes. Now that you guys have already a background what the Z codes are, we're going to go to let us go to different classifications of Z codes for us to learn more about what are the specific uses for Z codes. Okay. We just read this. Z codes are for use in any healthcare setting. It doesn't matter if it's inpatient, outpatient. If a patient has, is in the rehab, you are going to use the Z codes. And by the way, another Z code that I can give you example for, guys, are those patients who have did I mention about transplant status? Yes, I did mention transplant status, right? If a patient has some kind of prosthesis from recent procedure, like a hip replacement, there is a code for that presence of prosthesis. Another use for Z codes. Another use for Z codes, guys, are information about patient's history, personal history, family history. Those are Z codes. Let's continue here. Examples of status codes. Okay, so status codes, guys, Z codes can be assigned to indicate or to declare status. Examples of status codes, look here. HIV status, actually, if it's asymptomatic, you assign Z21. Okay? This code indicates that a patient has tested positive for HIV, not necessarily a full-blown AIDS, but patient had tested positive and asymptomatic. This is a status. You are to assign Z21. If a patient is under-immunized, okay, there are those people who did not approve of vaccine, right? You guys remember that during COVID? There are people who are anti-vaccines or they call it anti-vaxxers people. Okay, if if that person is under-immunized, not have been gone through any shots or prophylaxis for vaccine, then that's a status code. Look, there is a code for that. Under immunization status is Z28.3. What about if patient is pretty much confined in the bed? Z7401. So these are status codes, guys. If a patient has one of the limbs amputated, acquired absence of limb, that is a status, Z89. If a patient had a procedure where an artificial opening was performed, like a gastrostomy, colostomy, nephrostomy, so those artificial openings, like in order to, for patient to be able to perform those types of activity, like a feeding, patient is being fed through a G-tube, that's a status code, Z93. Transplanted organ, if a patient had a transplant procedure in the past, you are to assign a Z94 category code. And if a patient has some type of device like a pacemaker, it's a Z95 code that you are to assign in the patient's chart. So these are status codes, guys. Again, you can call it, I even label it as FYI for your information, because this health status are really important for the next user of the chart, for the providers, for the doctors, to be able to at least be aware. And because of that awareness, the doctor will now be able to create or give the patients the appropriate medical attention. Okay, so that's what those status codes are. What else? So Z codes are used for history. Let's read this. These are the two types of history Z codes: personal and family. Personal history codes explain a patient's past medical condition that no longer exists and is not receiving any treatment, but that has the potential for reoccurrence and therefore may require continued monitoring. Personal history codes may be used in conjunction with follow-up codes, and family history codes may be used in conjunction with screening codes to explain the need for a test or procedure. History codes are also acceptable on any test or procedure. History codes are also acceptable to any medical record regardless of the reason for visit. A history of an illness, even if no longer present, is important information that may alter the type of treatment ordered. Okay, so let's talk about it a little bit, guys. Now you see the importance of this history codes or Z codes. I'm pretty sure you guys, you've gone to a doctor's clinic and the nurse or the medical assistant started you off with asking you if there is a family history in your family. Of course, if you have a history of someone in your family have this type of a disease like diabetes, hypertension, heart disease, right? Or cancer. So I'm pretty sure you have experienced that. You were asked those questions, right? Because the family history of the patient are important for the doctors to kind of like zero into what kind of like treatment that is appropriate for you. If you have a family history of heart disease, then the doctor will be able to tailor his treatment or regimen according to your family history or personal history, right? So those are important information, again, that should not be ignored. Okay, because if a patient has this type of history, for example, history of cancer, and you're coming to the doctor's clinic, wanted to get screened for cancer, so the doctor understands that there is a strong likelihood that you may be carrying the genes and you are predisposed to this type of disease. Okay, so history codes, guys, family history and personal history are important in many, many instances because, again, of course, the doctor needs to know those information, right? Okay, what else? So we're done with this history. Any question, guys, so far with the application of Z codes? They're pretty standard, right? I mean, there's really nothing complex about Z codes. But again, let's continue to investigate what are the other uses for Z codes. Okay, screening. Screening is the testing for disease or disease precursors in seemingly well individuals so that early detection and treatment can be provided for those who test positive for the disease. Like, for example, screening mammogram, okay? A screening code may be a first listed code if the reason for the visit is specifically to screening exam. It may also be used as an additional code if the screening is done during an office visit or other health problems. Okay, let's talk about this for a minute. So screening, we now know that a screening is a Z code, which, you know, if you go to the doctor's clinic for that specific purpose to get screened or to have an exam like a colonoscopy, If it's a scheduled colonoscopy exam, okay, you go to the doctor, then the screening for cancer for colon is the primary diagnosis. That should be the first listed diagnosis, because the real purpose, or the only reason why you are at the GI clinic, the doctor's clinic, is to have that exam or to have that screening test. Okay, so your screening test, which is a Z code, should be assigned as a principal diagnosis. I think it's a Z11 if it's cancer screening. Now, if the screening happened alongside with a doctor's visit, let's say, for instance, you have been, experiencing hip pain for, say, for 2 weeks, and you've been trying to schedule a office visit, a doctor's visit, and so these days, guys, office visit or scheduling for a doctor's visit is a little bit challenging, right? It takes about like 2-3 weeks sometimes before you're able to get an open slot to get seen by the doctor. So it's more of like a norm now than a rarity. So you scheduled, or you wanted to see the doctor first, and because you have this hip pain for the last 2 or 3 weeks. Now, when you get to the doctor's clinic, and the doctor is not very was uncertain, or say the doctor is not sure what's going on with your hip, the doctor may request for that screening or imaging, right, to see what's going on with your hip. So if the doctor orders for a screening test, okay, that screening test, guys, is going to be assigned as the secondary diagnosis, because the main reason why you are at the doctor's clinic is not to get tested. The doctor still has to evaluate what's going on with your hip. Why are you experiencing hip pain? So Christine, so true, you just end up going to urgent care. Yeah, I mean, like you go to urgent care and you wanna get checked with this pain, or if you're nauseous, or you're experiencing migraine, the doctor want to see if what's going on with the headache, with the migraine. Why are you experiencing this continuous manifestations of migraine or headache? So if the doctor orders for a screening test, that screening test will be assigned as the secondary diagnosis. Your primary diagnosis will be the reason why you're having that pain. Okay, so there are many screening codes, guys. Screening for HIV, screening for cancer, screening for vision screening, colonoscopy, endoscopy, and whatnot. So there are many of those. Okay, and very straightforward. You don't have to really analyze it very like very deeply. Okay, screening is a screening. It's just an exam. Now, with all these classifications of Z codes, guys, like we know down the history, what we now know that there is a screening, there is a status. How do we look for those codes, right? So how do we look for those codes? For history, it's very simple. You go to history, and if you want to find out what the patient's personal history for this type of disease, then you go to history, personal, and then look for that disease, or look for that body system where the patient has a history of the disease. Okay, and if it's a family history, do the same thing. You go to history in your book, go to family, and then if it's family cancer, family, then cancer. That's how you look for that code. It's very simple. I mean, like, I'm not going to teach you now how to navigate your book, because we're way past beyond that that learning. Okay, you guys already know and well versed now in using your book. What about for screening? It's the same thing. Go to the word screening, okay, and whatever that screening is, if it's screening HIV, screening colonoscopy, there is a specific code for that. Any question, guys, so far? Okay. Now, what about observation? Okay, so what is this observation codes? Let us read. There are 3 observation Z code categories. They are for use in very limited circumstances. When a person is being observed for a suspected condition that is ruled out, I want you guys to highlight this word, ruled out. It comes out from time to time in the AHIMA exam. Okay? So this observation code is very, is rarely used because, okay, the observation codes are not for use if an injury, illness, or any signs or symptoms related to suspected condition are present, meaning that you only use this observation codes ruled out if that suspected condition is proven not present. Did I say it right? I mean, like, do you guys understand what I just explained to you? Meaning that you only use that observation codes if, upon looking at the patient's medical condition, they run the tests, they run the imaging, and after all those battery of tests and imagings and whatnot, they found out that the suspected disease or the suspected condition is actually not present, is not there. Then you use that observation code. Does that make sense, guys? Now, if we continue reading this, it says here, these observation codes are not for use if an injury or illness or any signs or symptoms related to the suspected condition are present. So it's very clear. In such cases, the diagnosis symptom code is used with a corresponding external cause code. Meaning to say that upon observation, and they found out that patient has this condition, right? Patient who came in with chest pain, and they run the test, and troponin was high, and patient's X-ray shows that there's some calcifications in the coronary arteries. Then the doctor said, "Hey, Mr. Patient, you are experiencing angina, coronary artery with angina." Okay. Now, if that's the case, the observation code now should no longer be considered because there is an actual disease. There is an actual diagnosis that a patient is having or should have. Maybe a patient had all this had this condition all this time. Okay, and this is the only time where it was discovered or was confirmed. You guys see what I'm saying here? So the observation code is rarely used, because when a patient comes into the observation, I mean, when a patient comes into the clinic, 99% there is a condition. There is something going on there, okay? I don't know if it's really 99%, but you're not going to an ER, to urgent care, if nothing is wrong, right? Well, sometimes a patient gets lucky. You go there, it's only a muscle twitch or spasm, and the doctor says, "Hey, yeah, that's nothing. We don't find anything in your X-ray. We don't find anything in your labs. You're perfectly fine," right? And if the doctor says, let's see for like 3-4 hours if you still feel that chest pain, and they run the test, the ECG, the stress test, and nothing was found with the patient, then the observation code is appropriate to assign.